I don't know why I'm host. Who's supposed to host? You're muted.
Just enable screen sharing. I don't know who it is. You can make me host. I can rename. Just as they come in.
Done.
Thank you.
I'll be right back.
Hello there. Gwen, can you make me the host and I will run tech?
All right. I'm doing projection. So
Okay.
you are the, that's fine. You're the hostess with the mostest. You can rename.
With the mostest.
Uh-huh.
Okay.
Not since the other day. Everything has been completely fine. I don't know what was going on the other day.
Okay, I'm gonna close my door so we don't have an echo in here. Yes, yeah, so that is.
Do you think we should email out the spreadsheet, like in a PDF form,
Register it and it'll send.
so folks can bring it up on their end?
The agency partners would probably appreciate that. Yeah. Not a bad idea.
Kelsey, would you mind sending a PDF of the spreadsheet to the Community Advisory Council?
Yes, do you want me to send it expanded wide with all of the little scores that are hidden right now? You don't want to just, okay. Yes, happy to do that.
I can hear the cat snoring from the closet floor.
It's way too big for me to PDF. It is okay if I send them a screenshot.
Yeah, that's fine.
Okay. Is today's going to be Connor's first meeting?
Yes.
Is he added to the roster?
I'd have to look.
I'm trying to open it up right now, but it's not there yet.
I'll add them on my end. I've got it open. If you're talking the roster, by the roster, you mean the Google document.
Oh, no, that's not where I'm looking.
Okay.
Can you just chat me his email address then?
Yeah, I'll do it. I got to look it up and get his application. So hang tight.
Oh, okay. Yeah, he's not on here yet. Hi there, Connor.
Hello, how are you?
I'm doing well. We haven't met yet, but my name is Kelsey Seymour. I'm the for now. I'm the administrative assistant for the Health Council. It's nice to meet you.
Nice to meet you too, Kelsey.
I was just looking around for your email address. We have one thing we're sending out to everybody real quick. Can you put that in the chat for me so I can include you in this?
Of course.
Thanks.
My parents gave me a difficult name to spell for some reason, so, and my last name gets misspelled all the time as well, so.
Who are you, Kat?
I was named during the Clinton era, and so my name is always
They
Chelsea.
had ordered just one and it took all three. There would be.
Awesome. Thank you for putting that in there.
Hello, hello. Welcome, Connor.
Hi, how are you?
I'm really well. Good to see you.
Nice to meet you, Donna.
Hi, welcome. I'm Kristen.
Hello. Hi, Kristen. How are you?
Good, how are you?
I'm fine, thanks.
Great.
My husband just brought me an amazing cinnamon roll, so I will try not to let it be all over my face while I'm eating it.
More like try not to make me jealous.
I believe that's too late for that, Kristen.
Yeah, I know. My mouth is watering. That sounds great.
He just went to his sister's bakery, so that'll do it every time.
Yum. Are you guys missing being within walking distance to Sparrow?
I think so. Yes, I do. Although I'm not a big pastry and sweets fan, but I do like their coffee.
Yes, they do have great coffee.
Hello. Buenas tardes. How we doing on enough people to start? Looks like we're a little thin.
We're a little light right now
Okay.
by a handful. Camille is going to be taking the notes today. And so Camille, if you want to let us know when we have a majority of CAC members present, feel free to put that in the chat or speak up when it's happened.
Yeah, while we wait, if people could put their names and so forth in the chat, that'd be cool. And then the other thing is there's so much negative news these days. If you could add something positive that's going on in your life, brief, but something positive, that'd be nice too. Some. Cucumbers.
And it looks like someone has joined us by phone, phone number ending in 5002. Can you let us know who you are?
Yeah, it's Buffy.
Hi, Buffy. Thank you so much for calling in. This is Kelsey. We don't have everyone here yet, so we're just hanging around for a minute.
Okay, thanks.
And Buffy, this is Brad. I've also asked everyone to add something in the chat, but since you're on the phone, you can share by phone something positive going on in your life. Because there's so much negative news, I just want to give everybody a chance to share something positive. If you'd like to do that, go ahead. If not, that's fine.
Sure. Something positive that's going on right now is the wind is dying down so I could finish painting my barn.
Nice. Thanks. Nice.
By my count, we need 2 more CAC members.
We need 2 more?
Yeah.
Okay. I guess we could welcome Connor as a new consumer representative member of our CAC. How you doing, Connor? You want to briefly introduce yourself?
Sure. My name is Connor Carlson, like Brad said. I am a longtime Bend resident. I was raised here, so I've been here since 1981, so a long time. Went out to the East Coast for 10 years and just came back the end of 2019, and excited to be a part of this and just trying to give back to my community as much as I can. So that's about it. I work at the Family Resource Center, which is a local Tri-County nonprofit here, where Brad and I met over corn dogs at Costco during a fundraiser there. So it was nice to meet you, Brad, there at Costco.
Likewise, thanks and welcome.
Thank you.
Kelsey, would you like to? I don't know if you're the one doing it this time or if the new person, your replacement, would like to do it, but help us with introductions.
Absolutely, we can help with introductions. Camille, can you give me a thumbs up or a thumbs down if you're willing to give that a shot today? Okay, Camille's gonna
No,
introductions.
I'd rather have Kelsey do it, actually. I was giving a thumbs up to quorum. I'm sorry.
Great. Yes, we do have a quorum now.
Yes.
Excellent. Happy to do that. Brad, did you already introduce yourself? I missed it because I usually start with you.
Brad Porterfield, consumer representative and CAC chair. Also happen to be the director at the Latino Community Association.
Awesome. Linda and Elizabeth.
Linda Johnson, healthcare, Central Oregon Health Council community representative, and pronouns are she, her, and hers.
Oh, Elizabeth Schmidt, I'm consumer representative for Central Oregon Health Council. Good morning, and thank you.
Yeah, good morning. Ken and Larry. Ken, you're on mute and I can see you trying to do stuff.
So let's try that again. Good morning, everybody. Ken Wilhelm with United Way. My pronouns are he and him, and that's me.
Thank you, Larry.
Larry Kugosik, Community Representative.
Great. I'm looking around my screen. I see Teresa and Regina. Oh, Teresa, I can't hear you.
Teresa Lander, Community Representative. I live in Benton.
Regina Sanchez, Community Representative, and I'm with Crook County Health Department.
Thank you so much for being here. I believe I got all of our CAC members, and Connor, we started with you, so that should be all of you. And we'll run through the Health Council staff. Michaela and Gwen.
Hello, everyone. Michaela Arsenault, Project Manager and Co-CAC Coordinator with Gwen. My pronouns are she, her, and hers.
Hi, Gwen Jones, she, her, hers, and CAC co-coordinator.
Great. Donna and Rebecca.
Good afternoon, everybody. My name is Donna Mills. I serve as the Executive Director for Central Oregon Health Council, and my pronouns are she, her, and hers.
Hi, everyone. Rebecca Berry, she, her, hers, and I am the Grants and Metrics Manager here at the Central Oregon Health Council. Nice to see you all again.
Renee.
Hi, everyone. Renee Worth, pronouns are she, her, and hers, and I am a project manager with the Central Oregon Health Council.
Great. And I am Kelsey Seymour. For those of you who have known me up to this point, this may come as a surprise, but this is going to be my last month at the Health Council, and Camille is my successor. She's in training with us, so I'll have her introduce herself next, but I wanted to say thank you all for the last 5 years. It's been incredible. I'll still be around. I'll see you all at the combined meeting next month. But just a heads up what's going on. Camille, go ahead and introduce yourself.
Hi, everybody. I'm Camille Smith. I'm just at the Health Council for a week today and looking forward to working with you all, and also very sad that Kelsey will be leaving us.
Thank you. Okay, let's go through our guests. Buffy, I know you already said the thing that's going well in your life, but can you also introduce yourself, and then Kristen?
Yeah, I'm Buffy Hurtado. I'm an enrolled member of the Confederated Tribes of Warm Springs, and I currently hold the position of Tribal Liaison for Pacific Source. I cover 7 of our 9 tribes, as well as 4 of the regions inside Pacific Source. Thank you.
I am Kristen Tobias, and I am the Community Health Coordinator for Pacific Source, the CCO, and my pronouns are she, her, and hers. Thank you.
Rebecca Donnell, and then Trisha.
Hi, good afternoon. Rebecca Donnell, pronouns she, her, hers. I'm the innovator agent at OHA, working with Pacific Source CCOs, the health councils, and the CACs. And my positive thing is I am cooking up a storm, putting up jam, putting up pickles right and left. And this weekend it's peach jam.
Hello, everyone. I'm Trisha Wilder. I am the new director for the Central Oregon CCO, and I will be going to Rebecca's house this weekend.
I don't think you'll be alone. Leslie, and then Tanya.
Hi, Leslie Neugebauer, Senior Director of Medicaid Governance at Pacific Source.
Hi, everyone. My name is Tanya Curiel. I'm with the Oregon Health Authority's Community Partner Outreach Program, and I am the Regional Outreach Coordinator for the Central Oregon region.
Thank you. If I have missed you, now is your chance to speak up. I believe I have everyone.
All right, thanks, Kelsey. And there's lots of best wishes in the chat. And I'm sure, I know, you will be missed. But welcome to Camille. So let's go ahead and move on to public comment. Anybody would like to make a public comment? Public comment?
I actually will make a public comment just in case we don't make it to the Flex Funds presentation at the end of the call today. Pacific Source in Central Oregon is out of Flex Funds dollars for this year. I just want to say that at the beginning today, just in case we run over, but if you have any questions, please reach out to me and hopefully we can make it to that presentation this afternoon.
Do our best, Kristen. And when do those get replenished? Like when will you?
In 2022.
Okay, January.
Yep.
Okay. Any other public comments? Okay, I'll take just a minute to make a comment. I took my son, who is an OHP customer, to the chiropractor last week. He had hurt his back and was having a lot of pain. And I was surprised to find out that chiropractic was not covered. And I talked to Anna, I know the folks at Natural Approach Chiropractic, been going there for years, off and on. And she let me know, Susan let me know that they've been trying, and Pacific Sources or OHA, or I don't actually know who says what, but has been saying that chiropractic would be covered for a couple, 2-3 years. And this year it even got on the benefits package, apparently, according to Susan, but they're still not being reimbursed. And so I just wanted to put that kind of out there on the table. Because I really think preventive care is crucial, critical, should be covered. It's low cost compared to other care. And that's the only upside, is it's even low cost when you don't have health insurance, but still money out of pocket. I just want to put that out there and see, let's see. I think we have enough time if anybody would like to respond from Pacific Source, but otherwise we can move that into maybe one of our emerging issues. Let me know, Pacific Source folks, if you'd rather us push that into our emerging issues process, or if you'd like to say anything.
Yeah, Brad, I mean, you said exactly what I know, is that we've kind of heard this potentially coming in or out of the benefit package. I know that this is a problem for many payers generally. I think that there's many facets there, but I think adding this to your emerging issues list is probably a smart idea.
Okay. And who makes that decision? Just to know kind of is that an OHA thing? Is that a Pacific Source thing? Is that
Yeah, so usually it would be, I assume, and maybe Rebecca can keep me honest here, but I think it's the HERC committee. I can't think of what the E is. It's Health Something Review Committee, Rebecca.
It's the Health Evidence Review Committee, and they decide in addition, but they basically review the clinical evidence around different treatment modalities and whether or not they're covered by Medicaid.
Sorry, I meant Rebecca Donnell, but Rebecca very new too, so thank you.
all right? Well, thank you. So we'll push that into our emerging issues process. All right. Did everybody get a chance to read over the minutes from our last meeting? And does anybody have, assuming you did, hopefully you did. And does anybody have any corrections or comments?
So Brad, I move approval of the minutes from the last meeting.
Okay.
Second, Linda.
We have a motion and a second. Any other comments? Good to move on. Okay. So please indicate by speaking or doing a thumbs up if you approve the motion. Say yay, yes.
Yay.
Thumbs up. Anybody opposed to approving the minutes? Okay, I think we've got our minutes approved. Thanks, everybody. All right, well, let's move on into the community health projects, letters of interest decisions. I don't know about all of you, but if you managed to review 15 of the proposals of the LOIs, thank you very much. It's a lot of work. It felt just as hard as reviewing proposals to me. So thanks to everybody who was able to do that. And I'll turn it over to Michaela and Gwen.
All right, let me find my unmute. So yay, decisions today on the community health projects letters of interest. And community health projects, also known as community benefit initiative in coordinated care lingo. I just want to do a quick refresher on community health projects, what they are, the process that we are going through, and then have a discussion around the letters of interest. Okay. So community health projects or community level projects focused on improving population health and health care quality. They're focused around addressing social determinants of health and equity, and they have to align with the regional health improvement plan. So along with addressing social determinants of health, they're meant to improve health outcomes, reduce disparities, promote the efficient use of resources, promote and increase wellness and health activities, and improve overall community well-being. This year, our budget is a little over 431,000. And that was due to we had 370,000 for community health projects, and then we had just a little bit left over from last year, and that was due to the calculations. And that's how we ended up. It wasn't that we didn't allocate enough last year. But as always, these funds have to be spent by the end of the year. So our deadline for spending is December 31st, which we will make. As you recall, this year, as opposed to doing just requests for proposals, we decided on a two-step process. And so that first step is asking the community to submit letters of interest to you. And what those letters of interest are just kind of a high level description of what their project is about. And then from there, you as the CAC would decide which projects you were most interested in funding or curious about, and you would invite them to fill out the full detailed application. So this is the first step in the review and approval process.
Michaela, I have a question. So the packet that I got was similar to last year's applications. I didn't understand how those were a letter of an interest because they seem to be full grant applications. Were they?
Yeah, so with the full applications, you'll get a detailed budget broken down by line item, a little bit more detail about what that project entails, places for the applicant to upload letters of support or letters of commitment with who they're planning to partner with, things like that. So there's more information that will be included in the full application.
Okay. Wow.
The letters of interest were a little bit long. Oops, just because we wanted to make sure that their projects actually did qualify for community health projects, and there was a lot of rules about what qualified and what didn't. So.
Well, I thought they were pretty intensive. This is my point of view. And I'm wondering why we weren't broken into 3 groups maybe, and then we'd have 10 each, which is what we had last year. And that was hard.
Yeah.
15 was a killer. So.
Yeah. When we had the conversation or when we were debriefing the process from last year, there was some suggestions or CAC members expressed that they would have liked to see all the applications, but on the flip side, they understand that it was a heavy lift reviewing all those applications. So we kind of wanted to find the happy medium between those two, and that's why we only split it into 2 groups.
The other piece was the number of folks reviewing each application. This year we were stretched, and each application was reviewed by 5 people. But if it had been broken down into even smaller groups, it would probably have been even harder to get, upwards of, 4 or 5 folks to review the grants. So we would get a little bit broader perspective from everyone. So it was tough. Yeah, there was a little.
Well, each group has 8 people in it. So.
Right. Not everyone was able to review. So when it came down to it, we had about 4 folks review each grant that'll feed into the results that you see.
Okay.
But this will be a good conversation for later. I think we're always looking to revise and update and improve this for everyone.
Okay.
Okay. So just a refresher on the timeline. I didn't put today's. Today we're making decisions on which letters of interest we want to see full applications from. And then the timeline after that, we'll notify the applicants of whether their letters of interest were denied or invited to fill out the full application. Those full applications will be due mid-October. And then you'll go through and score those final applications. And at your November meeting is when you'll make those final funding decisions. And then by the end of the month, those applicants will be notified on your decision. Just a reminder, in addition to these projects needing to address social determinants of health and health equity and align with the regional health improvement plan, you as the Community Advisory Council also wanted to prioritize projects serving rural areas and projects that serve populations most impacted by system barriers. Oops. All right, so let's look at the scores. Let me exit out of this PowerPoint, one sec. All right, and these scores were emailed out. I know not everyone has access to a computer and able to pull them up, so I apologize for that. Okay, so Kelsey compiled these the scores for you, and as Brad had mentioned, we wanted to give a big thank you for submitting your scores with only a week to review. We appreciate it, and we know that it took quite a bit of effort to provide those scores on your part. So I wanted to first go over the layout of the spreadsheet and then make a recommendation to you about one specific application and then have a conversation about the rest. So these scores or these proposals or the spreadsheet was organized around your priority. And so you can see these are broken down into categories. One is the tribal application, and then it goes into proposals that serve rural areas only, and then proposals that serve Bend and Redmond only. And then the last grouping are the projects that serve a mix. So they could serve the full region, or they serve, for example, like Bend and La Pine or Redmond and another rural community. So if you're looking at this from left to right, you'll have the organization name and then project name, and then the individual scores for each of the scoring areas that you submitted, the total scores for that application, the amount requested for that application or that letter of interest, how many years that project covers, what that's broken down to, like cost per year, and then which geographic area the project serves. And then there's some notes on the side about kind of which specific towns for the rural service area. Questions on the layout? Okay.
Hey, Michaela, sorry. Get my video back on. Is there also by chance a worksheet that would just have all these not broken out into the different sections or groups? Just kind of from perhaps highest score to lowest score?
There is.
Okay. Just want to
We
check
did that as well. We wanted to kind of, yeah, break it down so it gives it like a clear picture of what this group had wanted to prioritize. All right, so I want to make a recommendation to you. And my recommendation is that the CAC, so you move forward the only application that you received from the Confederate Tribes of Warm Springs with the intent of funding. And the reason for that is you, the CAC, prioritize projects that serve rural areas and the most impacted by system barriers. You've talked about tribal partnerships and the tribe being a part of the conversation, and this could be an important step towards that. The Confederate Tribes of Warm Springs and other tribes are sovereign nations, and we want to respect their sovereignty, their self-determination, their authority to self-govern, and also know what's best for their people. And as a sovereign nation, the tribes should have a seat at this table and take part in determining how these funds are spent, and they don't have a seat here yet. And since they don't have a seat here yet, the next best thing is the Confederate Tribes of Warm Springs, through their one application to you, is saying, you know, this is what we need to address social determinants of health within our community and to meet the needs of our people. On another note, there's language in our contract, and I've shown this slide to you before, that says CCOs must ensure a role for the CAC and tribes and how community health projects spending decisions are made, as well as also identify the role that the CAC and the tribes in determining whether investments are made and what amount and what should be invested in the community health projects.
So I'm not clear what you're asking of us. What are you asking of us?
So what I'm asking, my recommendation to you, is that you decide to move this application forward, and is the only application from the Confederate Tribes of Warm Springs, before we talk about the other applications.
Let's go ahead and anybody would like to comment or ask questions about that? Anybody like to share a comment or ask any questions? Can't tell if people have frozen up.
I don't think we have any.
I have one. So one thing that was a little bit confusing on these is the multi-year projects. And this one's a 5-year project. And there's a column that has amount per year, 16,000. Is that actually what's intended? That they will spend 16,000 a year for 5 years? Or is it a 5-year project and they're really asking for $80,000 to spend? However, could happen in 1 year, could happen in the first year, second year.
So Based on the letter of interest, they will use the 80,000 spread across some way across those 5 years. We don't have the detailed year after year budget of what they intend to spend each year, but the project will last 5 years using that funding for all 5 years.
Okay, because that was the question I had in the proposal, LOIs that I reviewed, my group reviewed, is with the LOI kind of format, it isn't entirely clear if they're, what they're saying when they say it's a multi-year project. Are they actually asking for multi-year funding? Are they asking, to spread that money that they're asking for out over that period of time? Or is there not really alignment there? So that's kind of a general thing that I'd like us to keep in mind. So the other comment I have is if that 80,000, if we fully fund it, that's a fifth, roughly a fifth, not quite a fifth of our entire 431,000. So I guess I just wonder, I'm absolutely support the project personally, but I'm not 100% convinced that it should be funded at 80,000. So I'd like anybody else who reviewed that proposal or anybody to share your comments about that.
Brad, this is Ken. And likewise, I thought it was a good project. It helps me to remember that this is a screening and not a grant decision-making process. So I just factored that out. In terms of how much of the available dollars it is for us. It also helped me move through the larger, getting through those proposals. I was gone last week, so I didn't get a chance to do it, to review that. I was able to do it in a couple of hours, which is not that it wasn't a lift, but I definitely didn't provide the level of scrutiny that I would have had it been a proposal as opposed to a letter of interest. So all that said, I would support that recommendation to move that particular proposal forward, and then want to hear about how we decide who else to move forward.
Thank you, Ken. That's actually super helpful. That helps me as well to understand that we're not actually approving the proposal. We're just moving it forward. Yeah. So I agree with you. I agree with Ken. How does everybody else feel? Does everybody support moving the Warm Springs proposal forward?
Yes. Yeah.
Yes.
Yes. Anybody opposed? All right.
Do we have to do an official motion or not?
At the end,
Would
maybe?
For this?
Would you mind doing an official motion just to move it forward?
Go for it, Ken.
My question about that, would you like an official motion on each one? Because I assume we're going to be coming up with another recommendation following this about some group, or by the end of the day, we want to approve a certain set that moves to the next level. Can we do that in one motion, or would you prefer that we do it in motions as we go along?
That's fine if you include it in another motion.
I think it might be more efficient if we just keep moving through and have a motion at the end to approve whatever we all agree on, as opposed to stopping each time.
I support that, and again, Ken here, and what I think we have consensus on is that whatever list we have, it will include this very first one, the shelter to independent living from Warm Springs, whenever we get around to that motion package.
Yep. Okay. Does that work, Michaela?
That works.
Okay.
All right. So moving on to the rest, it's your job today to select which letters of interest you like to file the application, and just these are the projects that you feel strongly about. And so I'd suggest only inviting 4 applications forward to fill out the full applications, the ones that you're really serious about funding. Understanding that you're going to be saying a no to a lot. And all these applications have great things to offer, and it's really not a reflection of their work. It's just a reflection of our limited funding and your priorities. So, and like I mentioned, those that are invited to fill out the full application will include more information about their project, including like budget, letters of support, MOUs, which is commitment with who they're partnering with, things like that. And then also understanding that most of you have only read half of these projects. So leading into a focused conversation, I have some questions for you to help us lead into a decision about which ones you'd want to ask to apply. So looking at this list, kind of maybe let's go around the room and see which proposals you're most excited about. Maybe just giving the name or the organization, just so we get a sense. So I'm gonna go down the list. Teresa,
yeah,
which project are you most excited about?
Healing Rains. Beyond, of course, the shelter to independent living, but also Healing Rains would be the top for me.
Thanks. Ken?
Are we looking at the other 29 applications, or because I don't even see some of them on my screen?
Yeah, and if it helps, Kelsey emailed out this spreadsheet for you.
It came from Kelsey. Yeah, I didn't actually see it. I searched from you, Michaela. Kelsey sent it.
Is there one you remember reading that you liked? All right, maybe just call them out.
Treetop. I like Treetop. This is Elizabeth Schmidt.
The Treehouse Therapies.
Yeah, because it's in-house. It has occupational therapy included, physical therapy and behavioral. And the kids don't have to go home to get that therapy. They can stay in school.
Mm-hmm.
I just liked it.
What are some other ones that you liked?
I really like, I like the COCC one on, they have two, but the one on connecting students to in need to basic resources. And I think that's the one that was support for community health worker students to be integrated into internships. No, that's the paving the path to healthier communities, excuse me.
All right, what are some more? How about ones that kind of fascinated you, ones that you've read? Which ones were kind of interesting?
Can I say one more? I like Saving Grace. They have navigators to help the people get on their feet. It's abuse, domestic abuse.
Thanks, Elizabeth. Brad, Ken, did you find one?
I'm still analyzing. I don't, I'm not very good at knee-jerk response.
It's hard to keep all of this in my little mind too.
Yeah.
Yeah.
The ones in general that I'm excited about are adding diversity to staff in order to be able to provide more equitable services and increase access for diverse populations. I just can't remember which ones those are at this point. I think positive choices might have been one of them. I honestly am not sure. And I do like the gardens for every school.
Yeah.
I like the neighbor impact if I can add a second one, the Neighbor Impact Mobile Food Pantry, because I also am just familiar with that and I've seen the people lined up and it's been an amazing resource, but I don't know if this is the appropriate time, Michaela, but just the fact it's over 10 years was a big question for me. Do we want to fund something that's over 10 years? And I apologize if you already discussed this.
I think we're in year 2, aren't we? I mean, they've used up some of their years. I noticed that.
Well, this would be for an additional 10 years.
Oh,
we've funded them in the past.
Oh,
I've never known a funder to fund 10 years. That's a lot of things change.
Yeah, and you could decide to fund less years. I don't know that they want to be reporting out for 10 years, but
Yeah,
For
Elaine,
8,000.
I raised that question earlier because I honestly, I'm not convinced that when people completed these LOIs that was their intention, that they really meant they wanted this funding to be used over those 10 years or over those 5 years.
yeah, and that's something you'd see in a full application.
Yeah.
So
and this is, I'm sorry, so this is Larry. I like the REACH program for parking because that's that's innovative for us here and very much needed. So that's my 2 cents.
Thanks, Larry.
And this is Linda. I also like the Saving Grace proposal. I love all of the ones that include the tribes. I was intrigued by the Corpine Community Land Trust project to keep people or for the net zero affordable housing. It impacts a small number of people, but it's also a small amount. And I just like that public-private partnership piece of it.
Versus 5,000.
Yeah.
This is Regina. I like the child center. If I can remember correctly, I just feel like that's where our route is for our children. And so if we can get them on track, then we can move forward in life.
Yeah.
So it sounds like we're covering the board here.
It does. So I want to bring you back to your priorities. So you said you wanted to prioritize communities most impacted by system barriers. What are those communities?
For me, the homeless is a real key piece of one. So I really supported the Bethlehem Inn project for that reason. They face so many barriers.
This is Ken. On that factor, Mountain Star would be one of the other ones that I would pull out, and because their clientele have so many stress factors or risk factors, I guess. To me, there's a lot of barriers for those folks. They don't identify as a population. They cross other group definitions, but that I believe that's a group that has a lot of barriers. So that's one I lean towards.
Thanks, Ken. So I guess which communities, or you can think about which folks are most impacted by system barriers.
The Shield is one that does that. It didn't rate high on my list, but that was what it was best at, as I think veterans are a group that faces a lot of barriers. But that I wouldn't support moving that proposal forward.
And I would go back again to the tribes as a really impacted area. And it gets an extra boost from me because it's a relationship that we have been challenged trying to build, the kinds of partnerships so that the proposals are from them, by them, and for them. And it's not our idea of what they need, but really they're working with us to build a first step of a good working relationship on that.
Thanks, Linda. Let's hear from some consumer reps on the CAC. what communities are most impacted?
My input is low-income families in general. And then some, not all, immigrant families that face unique barriers.
And for me, of course, it's the homeless. I would suggest that, for example, and Bethlehem Inn describes itself as that. Bethlehem Inn describes itself as a high barrier facility now. So.
Teresa, did you have a comment?
What does that mean, high barrier facility?
That they're very strict about behavior and drug use and alcohol and so forth. They're very strict on the screening, which is very much called for. But I just wanted to point that out.
Oh, okay. I thought everyone did that. Any homeless shelters and stuff, because it's part of keeping yourself okay with the neighbors, so to speak.
Well, that is a challenge, that's for sure. But the emergency shelter we have now that is open in front of Weimar describes itself as low barrier, and they do strive to be that.
Okay. Okay. Thanks.
All right. So I've heard for these communities, the tribes, low income, populations that are most at risk, homeless. Which projects address these communities?
Inventors were a group, so.
Wish I could remember. I mean, Reach definitely does for homeless. I'm not sure about CORE. Well, it's really hard to do this because I don't know what half of the proposals.
I know. Yeah.
What they do, but the ones that I'm aware of. Well, the other thing that I feel the need to at least mention and ask if those of you who looked at all of our scores noticed something similar, but I noticed that Group A has a lot of the higher scored LOIs, and I'm just wondering if Group A in general scored higher than Group B. And I mean in general, like, because I kept noticing my scores and I felt like they were pretty low. And it wasn't that I didn't think the project was a good project. It's the way that I answered those questions honestly, and
right.
They seem to be pretty low scores, pretty low numbers. And so I don't know if you have any insights on that. Those of you who have more time to look at these.
Since I have seen the scores aggregated from both groups, I can give a little insight. It did appear that there were both more generous and more harsh scores from Group A. So the breadth of scores is wider. The lowest and the highest came out of that group. And in Group B, it was a little more in the median. And that is just the nature of, and the personality and the style of each group. So it was very hard to put these scores next to each other and have them mean the same thing and line them up exactly. And I encourage all of you to look at everything in chunks that landed approximately near the middle, approximately near the top.
I think that part of recognizing that led us to this format that you see here, so that the scores are a piece of the decision, but not the entirety, and wanting to potentially, consider centering other information by way of, rural versus urban, county, tribal, those other really important things, knowing that the scores, because they're built by us, are imperfect as well. And I know watching the work groups, our learning as staff is watching the work groups go through this process is when we really center those numbers. We can't get away from them. It's really curious. And so wanting to really pull in other pieces to this conversation.
This is Linda. One of the suggestions for the future, I think the question about budget is really essential when we get the full grant proposal, but it was asked on this one, and the first couple that I rated, and I tried to actually go back and change my rating, I wanted to give them a 0 because there was no budget present. And then like on the third application, I realized, well, that's because it's a letter of interest, but yet I still am asked the question, is the budget reasonable? And so maybe that's a question for the LOIs in the future, that we don't rate them on if there's no budget attached.
Yeah, I think that's one that a lot of CAC members struggled with. And so we may do that differently next time. So I am going to go through, you said the communities most impacted by system barriers, and you also want to prioritize rural populations. I wanted to go through and maybe I'll just highlight some of those projects that touch on those communities that you've shared, just so we can see them better and they kind of pop out at us. All right, so feel free to reshare those and I'll go through the spreadsheet.
Hey, Michaela.
Yeah.
I just have a thought, and I'd like to hear your feedback, anybody's feedback, but one thing that occurs to me is, could we, like for group B, that's the group I was a part of, and the proposals I understand better than all the other ones that I didn't read. Could we like start making suggestions about, like in our case, the Darlene Erbach, you know, saying we'd like that one to go forward, and Reach, we'd like that one to go forward, because those are kind of, you know, at the top. They're in the areas. Well, Reach, I guess, has been remnant only, which is kind of lower on our priority list, but nonetheless, that's where the, you know, major homeless, houseless impact is. That's just a thought, like to get us started. Could each group sort of agree on 2 or 3 proposals that they really feel strongly about, get consensus on? That help us move forward, because I'm having trouble seeing how else we're going to move forward in the next 20 minutes. That might be one way.
Yes, one question to you all. Do you, since you wanted to focus on projects serving rural communities, did you want to even look at projects in that serve only Bend or Redmond and consider those or not?
Yes.
Okay.
Yes.
All right.
Because I don't think you could kick them out just because they're Bend and Redmond only, because I'm not even sure what, like Shepherd's House, you know, they're not everywhere, but they're critical, I guess.
Agreed, and the criteria didn't say you had to be, couldn't be Bend or Redmond or Deschutes County specific, so.
Right.
Okay. All right, so Brad, you're saying group A, say which projects they're interested in moving forward. And you said top 2?
Or 3 or 4. I think 3 or 4 makes sense to me, but because I mean, do we have an idea of how many total? Well, we don't, because of the amounts.
So
since we're just moving forward, you know, these 4, we're not making decisions. It seems like we need more.
But I'd recommend moving forward less than more.
Michaela, what about at the top? Isn't there a group that is the Warm Springs involved, or is that included in? Oh, okay, by eliminating the first set of columns, you've eliminated the orange. So that's cool. Now I see that they are included. So rural services only does include the Warm Springs involved projects.
Mm-hmm.
Oh, and what is the total ask? I know we have $430,000 available, but what's the total ask?
For which one?
For all of them.
1.6, something like that.
Just over 1.6 million.
Thank you.
All right, group A, review group. What is your, I'm gonna say top 2.
it's hard to speak for a group. The first two there, the Orange Springs Cat and the Lines for Life were high on my list, so I would put them in my short list.
Regina, are you able to give input before you jump off? Just on your two.
I mean, if I'm understanding correctly, there, you know, I'm for any homeless population, behavioral health for our children. It's really hard. I mean, we use a lot of Neighbor Impact, Saving Grace, Mountain Star. I mean, those are the ones that I'm more familiar with. I don't know, this is going to be really hard. This is a hard one because we only got to read half of them.
Yeah.
I don't know if that.
So homelessness and behavioral health and youth.
Yeah. Yeah. I mean, homeless is a really, you know, big one. There's so much of it going on.
And you're in group B, right?
Yeah.
Yeah. Okay. Well, thank you. That's helpful to know kind of your perspective.
And I mean, substance abuse is another one that I feel really strong about too as well.
Okay. We'll try.
Thank you guys. I wish I didn't have to jump off of this one.
Sorry, Michaela, we can go back to group A. I just want to get her feedback before she left.
For me, it's Healing Rains and Warm Springs Community Action Team. Those are my top two.
Right.
But yeah, I thought Healing Rains was really well done and thought out. And it deals with veterans, which not specifically just veterans, but also anybody really dealing with PTSD. And there's a huge need for it.
And this is Linda. I'm in Group A. So my two would be Bethlehem Inn and Saving Grace.
So for Regina's, I know she mentioned that she was most excited about the child center, so I'm going to leave that highlighted, but she didn't, and she listed categories. That's how I'm going to mark it for now. Did we go through all of the A group?
Before you move on with that, didn't we have Mountain Star on the short list? It looks like it doesn't have highlights anymore.
All right, has everyone from the A group shared?
I can live with it. It's messy, but I can live with it.
Okay, B group, what are your top two?
Michaela, can we explain about REACH? REACH is such a it's a good project, but it's very different, and I don't think anyone really knows about that. Could like Larry explain it or something? Because it's homeless people where they park and they get to live in their car and then get their life started again. And
Larry, is there anything you'd like to add to Elizabeth's description?
Yes. So about a year ago or so, some of us went to Eugene to study some of the, actually it's been longer than a year, God, time flies, to Eugene to research some of the things that they do. And some of that is already going on around town. So for example, Nativity Lutheran out on Rickard Road allows people to park in their parking lot. So there are a number of churches and organizations around town that would make their parking lots available. What they need is supervision. And Stacy, who runs Reach, would have the staff and the people to supervise the parking lots at night. So that's basically what it amounts to. It's really innovative and it's really good idea. Most of the cars up on Hunnell, the north end of town, if you guys have seen that camp, in a sense, it would sanction that because they're mostly RVs and cars that are parked up there as well. So, and they would provide supervision for that.
I'm sorry. Elizabeth, was your top pick Reach?
Well, I guess Saving Grace is my top and my second is Reach.
Okay. All right, others in group B?
I have a question. Do we fund capital projects such as pickleball courts? Can these funds fund capital projects?
They go ahead.
Yeah, so this does not count as a capital project. So it is fundable, otherwise it wouldn't have come to you.
Okay.
Yeah,
Thank
good
you.
question. I had to ask too. It's like, huh, intriguing.
Other people in group B?
I'm not in group B, but I would like to ask about positive choices. I'm somewhat familiar with that one. But it hasn't been called out, so was, but it's high on the list, as is Thrive in the Environmental Center. So can anybody speak to those?
Folks in group B?
I'm going through all mine, trying to get it straight in my head. I don't have it straight at all in my head. Who's who and what's what. I remember, I think, Ken, that's one of the projects that intended on hiring BIPOC staff in order to reach, increase access, but I can't say that with any certainty at all. I'm looking for it. Is there anybody else on the staff or anybody else in group B? COCC. Huge. There. So, the Child Center. The Child Center is one that I'm interested in. It's, I think it's a great project, I should say. The Child Center is proposing to provide school-based mental and behavioral health in the schools. So support, I know that our schools are pretty thin on counseling resources and support for kiddos that are having, trouble, more behaviorally than academically. There's a lot of kids having trouble behaviorally, just a lot of stuff going on.
So
I would pull, go ahead.
Sorry. Has everyone in both groups gone? So we're looking at this list together.
I haven't given you my two.
Okay.
Connor, did you get a chance? You're in group B, aren't you? To look over these or no?
No.
Okay. Okay.
He'll join us in the next step.
Okay.
Of the process.
So for me, I definitely like Reach. I do think it's innovative and needed, very, very much needed. I like the Child Center. I guess those will be my two. I also like the pickleball courts, but I think there's other ways to get that done.
All right, so the ones that we have at least two people, they're in their top two, is the Warm Springs Community Action Team, Saving Grace, and the Child Center.
I mean, I gave mine as neighbor impact and COCC. So I don't know how you wanna, but I only,
Your two are neighbor impact and which other one?
the COCC
Which one? I'm
connecting
sorry.
students.
Okay. Kelsey, can you give us a total for the Warm Springs Community Action, REACH, Saving Grace, and the Child Center?
That totals $280,334, and that does not include the Confederated Tribes of Warm Springs ask. Add another $80,000 onto that, which would make it up to 360.
360. Okay. So question to you all, do we feel comfortable with the ones that at least two people had it in their top pick to move forward?
What was your question, Michaela? Sorry.
Yeah, so some of these had two, I don't know, two votes, or two people at least said they were in their top picks for the application. Do we want to move these LOIs forward or these projects forward?
Which two are those?
So it'd be Warm Springs Community Action Team, REACH, Saving Grace, and the Child Center.
I'm okay with that. Yeah. What do others think?
I'm not seeing anything for homeless in that.
REACH is the one.
Okay.
Don't know about the others.
That's a good question. So calling out your priorities of rural, tribal, homeless, immigrant, and child behavioral health. How do those four sit against that?
Doesn't Saving Grace, those women have left their homes. They're in shelters because of abuse and they can't go back. So I think that's homeless.
Thank you, Elizabeth. You're right.
Good point. How do people feel, the rest of you feel about the moving these four? And we'll still have an opportunity to move additional ones forward, Michaela. We just want to, yeah. So moving these four and then looking at the rest. Larry?
Well, I would endorse the COCC programs because it combines dealing with some homeless issues and also emphasizes education, which I think is really important, obviously.
So how about we rephrase, let's rephrase Michaela's suggestion. Is anybody opposed? And then we can consider other ones like COCC, Larry. Is anybody opposed to moving forward the Warm Springs Community Action Team, REACH, Saving Grace, and the Child Center?
Are those the only ones we're moving forward, or are we just voting on those four?
Just voting on those four, and then we can consider additional ones.
Okay.
And the dollar amount again of those four plus the first one we had agreed to?
Yeah, it's $360,334.
And we have 431 remaining. Okay.
Yes.
But it also doesn't mean they get funded everything they ask for.
Right. Good point, Teresa.
I wanted to bring up controversial. Sometimes we look at, is the ask for 3 years, 2 years, 1 year? And do we want to discuss that?
It seems to me, Elizabeth, that we'll have more information to have that discussion when we get the full grant proposal.
Okay.
Which to me says, let's throw a little more in terms of proposals, not a lot more, but a little more in proposals than we have targeted funding. And then when we get the full grant proposal, we can see what we can wiggle in.
So So any other comments on these four?
I have no opposition to moving those forward.
I can support it.
Okay.
Me too.
Should we do a yay and nay so we know?
Yes. So Ken's a yay, Elaine's a yay. Others? Yay.
Yay.
Linda's a yay.
Yay. Elizabeth.
Linda's a-
Yay.
Elizabeth's a yay. Larry? Who else? Who are we missing? You support moving the four forward?
Yes, I do. Thank you.
Okay. And then Connor, are you voting? Connor's a voting member, right?
Yes.
Yes.
As I haven't read any of these proposals, I'm just going to go with the group. So until I get more up to speed, so I'll vote with the group. Yes.
Okay, and you're welcome to sustain. Yeah, fantastic. Thanks. All right, Michaela.
All right. All right, so the ones in pinkish red, those are moving forward. So we can have a conversation about a couple more to move forward as well.
I think Bethlehem and Thrive are really good. I don't know if they want to be included, but they're very good. They help a lot of people.
I think though we should not get where all the monies go to homeless programs and try and balance it.
Well, Bethlehem Inn, those people are homeless.
I know, that's what I'm saying. I'm saying let's not drop all 431,000 into just homeless programs. Yeah.
Okay.
I mean, every program has its value. Garden, every school has very big value, but you know, it's going to get cut. So that's my personal opinion. I think people do get really empathetic towards homelessness because it's tough.
It's helpful for me at this part of the discussion to look at the ones that were orange, that are orange remaining, because those were in our top programs. And for me, I'm going to make choices from that group.
Right.
Before you do that, sorry, Michaela. I'm personally not excited about that, only because when I look at all the orange groups except for Lines for Life, and I'm not sure who is Youth Line, the organization, or Lines for Life is the organization. I don't know anything about them, but all the other oranged organizations marked in orange are pretty significantly well-funded, established organizations, and nothing against significantly funded, well-established organizations, but I'm interested in the organizations that need the funding more, perhaps. It's an assumption on my part, and that are rural, smaller communities. So like the Darlene Urbach pickleball courts. That's something that will, be a lasting asset. And Culver's a pretty small town. They don't have much in terms of facilities like that. So that's just want to put it out there. It's the way I'm leaning.
What are some
I guess
thoughts on
I'd
that,
like
or
to-
some other lenses to look at this?
What was your question, Michaela?
I guess what are some comments or thoughts on Brad's comment? And then what are some other lenses that we can look at these proposals through?
Oh, lenses.
Or other
For me, program
considerations?
reach is important. Like how many clients are impacted by whatever program is being propose?
That's a good question, Linda. That could actually be an additional column on here. That wasn't one of the columns you hid, was it?
No.
No.
So program reach / impact programs that are kind of underfunded or don't have a lot of sustainable funding already that serve rural communities.
Well, I mean, you can see it twofold. So like Healing Rains, the reason they're requesting is they're expanding their program. I think they're trying to triple it, so they are established, but what they have right now isn't accommodating the need. So they're expanding, but I guess they are really established according to other people. So if we're looking at I don't honestly know who's not established. So maybe you guys could help us out.
Here's another question for another lens. Which of these programs are created by the people they serve? So would thus perhaps know them best and what the needs are and have tighter partnerships. There's a lot of assumption in that, but which projects are created by
Part of
those?
the Oregon Tour is one I remember that has heavy involvement from the tribes. It's up at the top.
What was it called?
The Heart of Oregon Corps Thrift Store Training. It's actually, that one. Oh, okay. Maybe I'm thinking of the Youth Satellite Team, but I thought it was Heart of Oregon Corps. But I may be wrong.
It is very, very, very rural. I think it's in Culver. I'd have to look
But
it
there
up.
was one that involved Warm Springs.
They do.
Heart of Oregon does. Okay.
I think that's a hard question to answer, Gwen. At least for me.
In theory, isn't Habitat supposed to come from the people who receive the housing? And their proposal is, again, to help people with repairs, or if they needed accommodations like a ramp because they're disabled. But isn't that a program that's supposed to be run by the people who receive the housing? Or not?
Some of their programs require sweat equity and others don't. But they don't, I don't think Habitat has board people from the tribes so that, or program managers or involvement with program managers as they develop whatever program they're going to be putting out in that region.
So we only have 10 minutes left. So we need to start kind of focusing in on some. What projects or programs do you think have like the most impact?
And I'm actually going to respectfully push back on the most impact. Often I'm curious about the assumption that we make under most impact. When we say that, what are we meaning?
Right.
Since I'm the one who said the most impact, for me, if I have $5 and I can give that $5 and make a difference for one person, even though the needs may be critically, but I could serve the needs of 10 people with that same $5. It helps. I don't know which one is correct, but the scope of how many people can be served with limited funds and to what depth has meaning to me.
How does that relate to our Central Oregon population breakout of 10% BIPOC or tribal throughout Central Oregon? Maybe it's probably a little bit higher than that compared to 90% who identify as white. And how would that relate to programs that might come from within the community and know the community well and have a greater impact but smaller numbers even by your population numbers?
It's a great question. For me, when I reviewed the grants, the only one that impact had a negative rating from me on was the core community land trust. It's important to be net zero, but looking at the project, it only benefits a few people in one specific community. And to me, that $5,000 maybe could be used more to benefit more people in another program.
Hey, Michaela, well, everybody, I'm just gonna suggest, at least for Group B, that I'd like to pick 2 more projects, and because this is very hard to do for all of us. And there's just so many variables and so much we don't know. But I would personally like to, for Group B, and anybody else in Group B, give your feedback, say the Darlene Urbach project, move that forward, because that's one of the very few kind of rural, very rural impact projects. And then also, if I can pick 2, the positive choices. And maybe Group A could do the same, and then we'll see where we land.
Can someone remind me what the Youth Line satellite team in Warm Springs is? Staff remember that one?
I think it was highlighted by accident, actually, but
No, it was a Warm Springs only one that was highlighted earlier, I think.
Yeah, as I recall, it's one that was taught, the objective was reduction of suicide, youth suicide.
Okay.
And as I understand, it's kind of through peer counselors or peer.
Brad?
Yes.
This is Buffy. That project, they've actually been working with the Confederated Tribes of Warm Springs Behavioral Health Center and Prevention for the last 3 years to stand up a satellite training center so that our youth could get trained to be peer support inside our reservation, as well as the exposure to ultimately getting outside of the reservation and just being able to be that tribal youth voice to help reduce the number of suicides across Indian country, but also ultimately across all communities. So that was that project, and they actually have been working with the tribe.
Thank you for refreshing my memory. I didn't want to, as a Group A person, I didn't want to list that as one of my 2 if I couldn't tell you what the program was. So my 2 would be that program, the Lines for Life, and Bethlehem Inn.
I support the Lines for Life, and I think I support the Bethlehem Inn, although I also like Mountain Star.
Yeah.
For advancing.
I think we should advance all of these personally that we've come up with, because we've already really narrowed it down. It's kind of.
What would that look like? Go ahead.
Group B, the Darlene Urbach positive choices, and other people in Group B, what were your thoughts on that?
Well, this is Elizabeth, and I like the Culver Park pickleball court because you're mixing many generations, and they don't have much, and it's free, and it would just give them something for the community to participate in. So I liked it.
Other Group B members?
does it fit Regina's? Let's see, homeless, behavioral health and youth. So I would say that the pickleball courts could, it's hard to say, but it could work on behavioral health and youth. Impact those two groups or issues, for lack of a better word. Positive Choices is in the schools and works with a smart reading program, and it's pretty extensive across the Tri-County area, as I recall. Which could
So-
definitely impacts youth, could impact behavioral health, not homeless.
Okay, and then Group A, Lines for Life, Mountain Star, and Bethlehem Inn.
Yes.
Yes. Yes.
Probably not Healing Rains.
All right, let me. I'm gonna undo these real fast.
I would just like to release some of our torture. In a better world, all these organizations would get money, and I think whatever decision we make in the end is going to be a good one. So, my 2 cents.
Thanks, Larry.
So that's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 projects.
I think that's a manageable number to consider full proposals for.
Can we get a money number? I'm slow on even finding my calculator here.
The extra or the 5 projects that were labeled just now, I want to make sure I have this absolutely correct. It was Lines for Life, the pickleball court, Positive Choices, Mountain Star, and Bethlehem Inn. So there's 5.
Correct.
Okay, great. Those together total $319,000, and combined with the ones that we had already agreed to move forward, that is $679,000 worth of proposals out of a $431,000 budget.
Elsie, that doesn't include the 80K though, does it?
It does. I added
Oh,
that
it
in.
does. Okay, thank you.
Yeah.
I would propose that it's good enough now to move to the second
great.
stage, and that we just recognize we have still some squeezing to do at the final proposal decision. Final grant decision.
Is that a motion, Linda?
Sure.
And I second that. As Ken.
Anybody opposed to the motion to move forward with these 10 projects, to invite them to submit full proposals? No opposition? Speak now or forever hold your peace. Okay, I think we're good. Thanks, everybody. This is a really difficult process.
Thanks,
But,
everyone.
we learn a lot about a lot of great projects in the community, so.
You did
All
it.
right, well,
On
we
to the
are
next step.
fresh. What's that?
I said, you did it. On to the next step. Congrats.
Thanks, Michaela. And we're out of time. So real quick, sorry, Kristen, for once again pushing flex funds off the map, but there's none available anyway, so we'll bring you back and hear from you eventually. For the emerging issues, we do have a process, a draft process, I guess, but I think it's pretty darn close to essentially being a final process that we're going to start to actually use and move at least one issue through to see how it works. And Gwen sent out an email to CAC members yesterday or today, I forget, letting you know that there's going to be a small group opportunity to work on that and to actually move one or more issues through the process that we've developed together. So please look for that email if you're interested in being a part of that small group. And then we can, that's going to be between now and the next meeting, right, Gwen?
Yes.
Yeah. And then the next meeting is the combined Health Council Board and CAC meeting in September 9th. Is that right? Yeah. So looking forward to that.
Brad?
Yes.
Brad, this is Donna. I just wanted to remind everybody that, and it'll come out right after this meeting, that the results of the survey that you completed, of which I want to give you my ultimate thanks for doing that, and the board completed theirs. Those results will be in this email that follows this meeting, and there's a short survey, like 3 questions, so that we can better hone in for those topics for the combined meeting. I'm really excited about it. I hope you all can make it. And it is just for those that are visiting today, that meeting is just the board and the CAC. It is not considered a board or CAC meeting.
Fantastic. All right. Well, thanks to everybody who put energy and time and talents and et cetera into this process. As Larry said, we're going to fund great projects, and we just have to live with the fact that we can't fund everybody. So thanks, and enjoy the rest of your day and week. And welcome again, Connor.
Bye, everyone.
Thanks, Brad. Thank you.
Bye, thank you.